And many people don't understand exactly what orthopedic trauma really is. I think a lot of people associate it with being in the emergency room or some sort of really acute problem. But the reality is that orthopedic trauma is really a subspecialty of reconstructing patients who have fracture problems. And those might be really complex issues. For example, a patient may come in with a very bad pelvis fracture or hip socket fracture associated with a car accident, or it may be very downstream, say a year downstream, where someone has had a fracture that has been fixed and then has gone on to not heal. So there's kind of a broad spectrum of things that we do. In the 1970s, the first anterior hip replacements were performed here at Yale. That, along with my training in trauma, really jettisoned me into a career for hip replacement surgery. And the reason those two overlap are that the anatomy is extremely complex, and putting those problems back together can be very challenging. But we've been able to manage to do many of these in a minimally invasive fashion, and that's really what we're searching for, is really to improve the activities of daily living, decrease pain, and increase function.